Namaskar. This is Dr. Puneet Mahendru, and we had a counseling children session, a wonderful interview with Miss Monique Ordon, a very experienced child therapist whom I respect a lot. And because it was in real time a few years back, I wanted to kind of give you some slides to refer to and add a little bit myself. And you can hopefully combine this with Ms. Ordon's interview session, which you may find in the beginning, because it is happening in real time, that you might need to fast forward to a point where the interview actually begins. So, you know, we hopefully will discuss some more, but let's start today talking about what exactly is entailed in counseling children and how might it differ with what we are already doing, and how might it differ with how we work with adults, and what are some of the challenges that parents in the Indian diaspora experience. So these are some of the things I hope to cover today a little bit. And hopefully you will all be able to bring some more to the discussion table as well. And I have a very happy new year. I'm recording this on the 1st of January, 2024. So hopefully we work well together in this year. I'm going to start sharing my PowerPoint, so bear with me 1 second. So hopefully you can see my screen here. And I want to start off by a lovely quotation from Khalil Gibran, which starts off this way, that your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. They are with you, yet they belong not to you. You may give them your love, but not your thoughts, for they have their own thoughts. You may house their body, but not their souls, for their souls dwell in the house of tomorrow, which you cannot visit. So you'll see a few things coming up here, which might seem a little bit contrary to how you envision, your children and your connection with your children. So it says that, children are these young jivatmas that we are sort of taking care of and nurturing, but perhaps seeing them as extension of ourselves, trying to fulfill our dreams through them, and of forcing our desires, our thinking process on them, might bring about a lot of conflict. And if we kind of hold them gingerly and kindly and nurture their spirit, their body, and allow them to be independent persons, we share with them values, we teach them our cultural values, but yet we don't necessarily force anything down as such. So that allows us, to kind of let them be their own individuals. And it also helps us see that we might need to, at some point, step away from them and, also have a life of our own. I think because we give up our life, this is particularly for Indian parents, that we give up our life for our children, that we have expectations, sometimes too much, sometimes unrealistic, and that can breed conflict, right? Now, I want to go on to the next slide here. So Dr. Mala Shetty has written a beautiful blog, which I'm hoping to share. We haven't been able to do that on the website as yet. And we'll let you know when that happens. So please do go ahead and refer to that. As I'd said, that the new child is viewed as Jivatma, a spirit soul, which has come to fulfill its own individual sadharma. So you see, what Khalil Gibran said wasn't very far off from this, right? And parents and family are encouraged to approach with a sense of sacred commitment. Once again, sort of really, so you see that, when we go deep down, that truth sort of transcends cultures and religions. So the main sanskars that we have in our Hindu tradition are those of God Bharai, Namkaran, Annaprasan, shaving of the head, Vidyarambha, Upnayana or Janeu, and Ritukala. These are some of the main milestones in sanskar. And Dr. Sethi talks about how these parallel the development in the brain as well, that there is, a specific reason and stage of development wherein these sanskars are performed. And I think some of you are probably familiar with these quite a bit. Okay. Now, once again, talking to children, we have in counseling children talked about open-ended questions. And I think a number of people said that, when we ask our children, how was the day? They just say, oh, good or bad, or, like one word answers, and that gets even more sort of brief as the children get older and as they become teenagers. So kind of finding a way to connect with them at some point is very important. And that is something that we have to sort of inculcate mindfully right from the very beginning, to join them in one of their interests. This is something that I learned the hard way, and perhaps a little too late. So, my children are, adults now, and I didn't necessarily know some of these things. And I really didn't have interests in common with my children when they were growing up. So this is kind of an important thing to have, to kind of join them where they are, right? And have conversations about their interests. So if they are fond of, say, basketball, or if they are fond of some video games, then trying to get to know that and have interesting conversations about that will allow you then to have an open communication channel wherein you'll be able to bring in other subjects and talk about other things as well. Also, these conversations need to be a part of everyday life. We cannot just, talk about what's happening in school, just before exams or tests, or just talk about education per se, but really rather, think of these little beings as persons of their own that we can sort of interact with and have regular conversations with. Another important thing here is to have a certain level of transparency, and I'm going to talk about that again a little bit later too, is to share with them a little bit about our own life, whatever is pertinent, whatever is, in a bite-sized manner, something that they can sort of understand in their simpler language, but to share with them. We try to protect them from anything negative that might be happening in our life, whether that's stress at work, or whether it's, a loss that might happen at our business, or a loss of someone in the family. And we kind of say, well, you don't have to worry about it. We'll, so kind of just keeping them away, not having those conversation in front of them. And children sense that something is off. And that uncertainty and that knowing something is off causes more anxiety. So perhaps just sharing with them in bits and pieces that, this is what's happening, but this is what we are doing, and we will work through it all together, is probably a better approach, rather than trying to build a wall again around them. This is even more so important here amongst the Indian diaspora, because we don't have a lot of other extended family members to mediate or to absorb that stress when the children are watching the parents. There seems to be a greater relation, time spent in the same household between parent and children, since uncles, aunts, grandparents may or may not be around. So they're going to witness our emotions and our reaction to stresses. So it's probably better to be open and share about that. What's important is also to we want children to be able to express, there's so much stress here, bullying, and we hear about children committing suicide as early as middle school, high school. And so we want them to be able to share with us what's going on and to recognize the emotions. And that has to start early on, when they are very young, to help them understand the difference between what's a thought, what's a feeling, to help them understand that all kind of feelings are okay, and just because they're feeling a certain way doesn't necessarily mean that something terrible is going to happen, right? So, you can feel anxious, but doesn't mean that something terrible is going to happen. So kind of helping them navigate some of those emotions. And they can kind of, and helping them know the difference between what it means to feel angry or jealous or anxious or sad. And whatever they come up with, and if they do express something, to not minimize or, well, why are you sad? There's nothing to be sad about. Why should you be anxious? You prepared. If you work hard, then there is nothing to be anxious about. So kind of that invalidates their feelings. It might be better to sort of acknowledge and accept their emotions, and allow them to accept it as well, that it's okay to feel sad sometimes or anxious sometimes. And when that happens, I am here to speak with you and to work with you on that. So kind of providing them that nurturing, accepting sort of base to come back to. But it's hard to do that. It's hard for them to share these with you if you are not transparent with your own emotions. If you are really sad, but don't kind of ever acknowledge that in front of them, or get angry instead of sharing that there is something stressful going on at work. So it's true that they are young, and you don't have to unburden everything on them, but in bits and pieces, being open about it, that Amma's feeling a little stressed today because of this and that, but it'll be okay. So letting them see that one can feel stressed or anxious or sad and still work through it and manage to accomplish the goals. That is the important thing for them to know, that they can have certain emotions that are uncomfortable and yet come out of it meeting their requirements, meeting their goals, um, in a kind of a healthy manner. And if they are struggling, to sort of share them with you. Let's talk now about emotional intelligence, how we can sort of inculcate that amongst children. So emotional intelligence is what we just talked about, just recognizing emotions and sharing them. Some of the things that are helpful, so some of the skills that are helpful in developing that, other than having conversations and being transparent, is, uh, not comparing children with other children. This is something that we tend to do at home. We compare see, so and so, your friend Sohan, he did this, or why can't you do? Or and then we feel that they need to have a role model, and in sort of our desire for them to have a role model, we'll compare them with their siblings. She's always getting a great report card. How about you? She got 5 A's, and you only got one. Next year you need to beat her. So kind of putting that pressure and making those comparisons is not helpful for their emotional stability. If they do have a difficult time, one of the tasks that helps them, that you can encourage, and I think in many schools they encourage that, is that of journaling. And gifting them a nice colorful journal where they can start sharing their own thoughts. And you can even set aside a journaling time where you and your children sit down in their respective journals, and everyone writes a little bit about what might be going on. And you can find some easy ways of how to go about journaling for children, if on Google itself. So that might be a good task to sort of encourage them to look at their own thoughts and their emotions. And then another activity that can be helpful in sort of inculcating emotional intelligence is perspective taking. Trying to see things from another child's point of view, or somebody else's point of view. I can see that you were angry, but what made you feel this way, and is there another way of looking at it, at this particular situation? A non-judgmental, respectful stance. Somehow with children, we tend to be very judging and blame and shame. In fact, I say that Indian parents feel that by using a blaming and shaming and comparing, we can keep children toe the straight line and get good grades and good jobs and so on. And maybe that happens. However, there is a big sort of an emotional toll that comes along with it. So to refrain from blaming and shaming and comparing, and keeping that in mind, also walking away when you're angry rather than yelling and screaming. I think a lot of parents now recognize that hitting is not a good idea, but they don't think too much about the yelling and screaming, which is just as uncomfortable. And then teaching young ones to breathe deeply. So a little bit of yoga helps, of course, but even if they're not doing any yoga practices, to just teaching them some 4x4 breathing in to count of 4, breathing out to count of 4 when they're feeling a little nervous or anxious, encouraging them to be physically active when they are sad, and having one or two people other than parents whom the children can talk to, one or two other adults, sometimes it's easier for children to talk to someone else other than their own parents. I know that my children would have long conversations with one of our family friends, and I would be surprised that they would be chit-chatting with him for an hour on the dinner table while I was getting the dinner ready. So, keeping having such persons around is helpful. Then, and not feeling that, and kind of giving your children permission that, if you're feeling sort of out of sorts, you can go ahead and call this uncle or this auntie and talk to them. It's okay, rather than kind of say, okay, the family secret should not go out, and we constantly having this idea that you have to appear as perfect parents, and that you don't want the children to say anything negative about their own life or about you to others. So getting out of that sense of creating a false mask, a false sense of perfection, being okay with a little bit of sharing, right? And then if there is a loss or any or abuse that's going on, to acknowledge that, when there, if a child loses a grandparent or an uncle, to sort of uh, be validating and acknowledge, rather than not let them know. Very often when there is a loss of a parent, a grandparent, or some other significant person in the family, children are sort of sent off to somebody else's house, and they don't get to know about what's going on. So, and I mean, nothing wrong with sending them to someone else's house, so long as there is some amount of communication about what's going on, whether there is an illness, and sort of sharing that with them. Also, if a child does complain about a parent or someone else hitting them, or saying something that is abusive or verbally or emotionally, to acknowledge that impact, rather than don't talk about this. It's not good to speak like that about your parent or about your mother, or it's not good to speak like that about your father. So that is very invalidating, and it creates a lot of anxiety in the child. So it's probably, for the other parents, it's probably, or a grandparent, it's better to sort of acknowledge that what they're experiencing is difficult, and that they want to support that, and maybe even get them some professional help if need be, if they're experiencing something difficult. Okay. Now, the other question people ask is how to know when to seek help. So it's kind of important then to know, well, what is appropriate for an age and cultural group, and to stay connected with other parents and teachers, and then see what are the effects on daily functions, bodily hygiene, and hobbies and friendships. Are there significant changes in behavior and personality, school performance, weight loss or gain? Um, you know, Sometimes people say, "Oh, this is, a parent talking to me and saying that, oh, my daughter's really kind of feeling low. I think, she's a teenager now, so she's, feeling depressed, and sometimes she talks about not wanting to live, and but I think it's just teenage years." So they kind of don't know what exactly is normal teenage issues and what is a little bit more than that. This parent's daughter was actually suicidal, and this young girl, was experiencing a lot of verbal and emotional abuse from her father. And the mother minimized it, and the mother thought this was just regular, um, you know, teenage stuff going on. So to recognize when, what is sort of within the normal range, it's important to have an open communication with other parents, teachers. And if you still are not sure, to always check in with a counselor. You can just have a single session, one session uh, with a child therapist to see, this is what my concerns are. Sometimes you can just talk on the phone with the triage line to find out if uh, some of the experiences of your children fall within the range of being okay for that age. Um, so being open to sharing, talking about it, and that will empower parents. That will give them a sense of, okay, I'm doing what is helpful in this situation. And of course, one of the easiest thing is to ask them, that, it sounds like you're going through a difficult time. How about I make an appointment with a counselor? And saying it in a very matter of fact way, because sometimes what happens is that if we have, sort of dismissed counseling with them in the past, then they're not going to be so receptive to it. So we have to be mindful that we have that open, conversation about that, and treat it just like a medical appointment. Now, I wanted to let you know that there is this research lately, especially in the last few years, which has shown without, beyond any doubt, that if a child experiences any adverse childhood experience, even if it happens at the age of 2, it has a long lasting impact. They say that trauma begins at home. Usually it is not outsiders who come and traumatize the child or who come to abuse the child. It is usually someone in the family, maybe extended family at times, especially when there is inappropriate touching or sexual abuse, but physical abuse and yelling and screaming and emotional abuse usually starts at home. So something like that, even if it happens for a short time, impacts the individual the rest of their lives. And if the trauma is during a pre-verbal age, it is very difficult to work through that later on in life. So do not disregard it as something, when someone is an adult, and this probably applies more to adults than children, to not disregard some negative experience of theirs that happened when they were 2 or 3, to know that it can sort of have long-standing influence, even at the age of 30, 40, 50, 60. It can actually, just a few such experiences, or even a single such experience, if it's significant, can create a sense of trauma and a lack of safety at the age of 60, 70, and shape the relationships that we have, because it creates a lack of safety in interactions with our adult friends and partners. So it's really important that when these experiences are happening to children, that we not just wait for the incident to be over and put a stop to it, but that we make an effort to allow the child to process that. We talked about journaling, talking to a therapist, there's play therapy, sandbox therapy, different ways of processing the trauma. So that it's not, it does not have a lifelong impact, right? There was an incident, a small study, in Europe when there was war. Uh, in England, some of the children were sent away to be away from their parents. They were sent to the countryside. And they found that later on, those children who were sent away to be protected and away from the bombing that was going on in England, in the city, in London, uh, experienced more distress than those who stayed with their parents and the parents, because being able to feel connected to the parents and protected by the parents was far more valuable than being sent away and being separated and away from the parents, even if they didn't experience the bombing that was going on. So, despite the negative occurrences, being with the parents in a nurturing way was more helpful than being sent away to the countryside, where they didn't experience those negative effects of bombing, but there was separation from parents. Therefore, the impact of separation from parents can be more traumatic than anything else that might be going on in the child's life. It's also important to recognize that children can express depression and anxiety in a different way. There's usually more acting out, there is fear, there's separation anxiety, there can be more agitation and restlessness when they're depressed. And an interesting thing is that sometimes they will be very depressed and talk about suicide 1 minute, and then within an hour, a few hours, they behave completely normal. So that can be very confusing for not just the parents, even for the therapist. I have seen children who have, a 12, 13-year-old child was, in the morning complaining of wanting to kill himself, and the parents brought him to the emergency room, and I'm seeing this child and he's laughing and happy, and this has happened on many more occasions, not just one. So in such a situation, to kind of seek out help rather than say, oh, he was just goofing off, and it's better to kind of take that seriously. And as I said, when you talk about a therapy appointment, kind of in a very matter of fact way, treat it like a medical appointment, discuss what it might entail, stay calm, not be judgmental, don't get super anxious about the, talking fast and talking loud about how they need to make an appointment and being all worried and anxious, because that's kind of going to make them feel that something is really wrong, and sort of shut them up a little bit more and not share about their upset feelings. Now, there are different kind of therapies that counselors use. As I mentioned, there's play therapy, sandbox therapy. There's also cognitive behavior therapy, which aims at changing some of the negative thoughts that children have. There is also action commitment therapy, which therapists use for children. So different strategies, different ways are adopted by the therapist, and sometimes they may just have their own eclectic kind of a methodology. So trusting that. And you'll find it disturbing that that you don't come to know so much about the child's therapy session. But it's best if we are not sort of interfering in what's going on between the child and the therapist too much, because the children do best when they can trust the therapist to maintain their confidentiality. But if something comes up that really bothers you, you've noticed a significant change in the behavior, in their grades, or any other specific incidents, you can talk to the therapist, you can call them, you can even bring it up during joint sessions. But when the therapist and the child are together, avoid being too nosy. So what did she say? Huh? So what did you say? There's, uh, it's best to sort of, let them kind of feel safe that they can talk to the therapist in confidence. And it's also helpful if parents themselves are open and willing to share with the therapists what they are experiencing, what their emotions might be. Often, when we work with children, there are assignments that can involve parents as well. So, sort of making that a priority and giving them importance. Uh, and not dismissing them, or it's what she asked us to do, but we've got a wedding coming up, or we've got uh, work load, and this is too much for us to handle, kind of. I mean, of course sometimes things can come up, but as far as possible to sort of just honor them, right? Because if you don't honor that relationship with the therapist and what's going on, then it's not going to be possible for the children to honor it either, right? Or to take it seriously. So some of the things that come up with children in the Indian diaspora is, as you all know, we focus so much on the grades and which college they will go to. I mean, sometimes there is a conversation about, we're so hyper focused on which college that if it's a question about um, those of you who are in the US, I mean, I'm in California, so I'm just giving you these examples, or whether it's going to be UC Berkeley or whether it's going to be UCLA, like there is the most perfect answer, and that there is one answer, and that if you make one choice of school or college versus another, that it's going to have lifelong impact, and that's just not true, right? Or children, parents bending over backwards to send the children to a certain school or to move to a neighborhood so that the children can go to that one particular school. Well, it's important to be in a neighborhood where there are children are safe and schools are good, but it isn't that there is one specific answer best. I mean, I myself am guilty of that. I mean, there were hours and hours of conversations at home whether the child should go to a certain private school versus a certain public school versus yet another public school, and so on. And really none of that matters as much as we think it matters. And I'm sharing that because, as I said, I've been guilty of it, and my two children, they went to took very different routes, and I can tell you that neither of the two routes was better or worse than the other. So keeping that in mind, the children struggle between our collectivistic Indian culture and the need for individuation that comes, that value that comes from their peers. So instead of constantly trying to pull them towards the collectivistic culture, it's important to work with them and to explain to them this difference and to help them navigate it, rather than saying that the emphasis on individuation is wrong. Because as you know, children listen more to their peers, because if you say that that is wrong, chances are they will try to prove you wrong. So helping them negotiate the two different cultures and finding a way to see what they want to keep from which culture will be a better approach. Now, children also sometimes take advantage of this, and they say, oh, you don't know how this is, and they are more dismissive of what the parents ask might be, because of this cultural dissimilarity. So when you show acceptance towards certain norms, like wanting freedom or doing or the milestones children have, such as the prom night, then they are far more willing to sort of be more open to some of your values. So, I think I already mentioned about not trying to control the agenda of the therapy. One of the challenges, some of the challenges that parents from Indian diaspora may have, of course, are navigating two cultures, accepting different cultural milestones, um, along with some of the Vedic samskars, bridging those two, kind of having a more holistic, cohesive approach to that. And then it's hard for parents here to manage because they themselves are going through this, two different cultures, adjusting into different cultures, and then they're trying to succeed, do well without having that extended family support and in a culturally strange environment. And with very little support. So it's hard for them to find that work-life balance and sort of it's a challenge bringing up children in a country away from your parent country, or and I imagine that many of you are probably already second generation, so that might be a little bit better, but especially for the first generation, that it's quite a challenge. And I think I'd already mentioned that in the beginning to curtail the need to compare one child to another. And another thing is that we tend to parent the way we were parented. We tend to have the same emphasis on certain values that our parents had. And that is something we need to, visit and look at carefully, because with the internet and travel, the world is very different from what it was 50 years back. So to hold those same standards is really, really not fair. Chances are you are not the same that you were 50 years back. You don't do things the way you did then, or your parents did then. You don't gather information. You don't. You probably have far more technology that you have access to and that you use and rely on. So it's a very, very different world. So to have the same expectations and same values as parents had from children 50 years back or even 100 years back is not really realistic, and it's also not fair. So it's kind of looking at it, revisiting it is important. So I'm going to stop sharing now because this is all the slides I have for now. And as I said, do listen to Monique's interview. She has a world of good advice and suggestions. And I just made this as an additional, video to see if certain things can be put in a slide format so that you can, add to it, you can revisit it, and you can ask questions based on that. So I'm sure there are other things that I've left out, so hope to bring them up in discussion. And good luck and take care. Bye. Right.